In order to share with you some of the aspects of cranial anatomy that we see among rodents, I want to begin by looking at the skull of an Aplodontia. This is known as a mountain beaver. The species name is rufa, and it's quite unusual for a rodent. Here you see its skull in the middle and its lower jaw that I segmented out separately in a CT scan on the left. And I'm comparing Aplodontia with a guinea pig, Cavia porcellus, here on the right side of the screen. So let's start with Aplodontia, and you see the upper dentition, the lower dentition, you see the zygomatic arch, and the jaw articulation. The glenoid on the squamosal is right there, and that's where that dentary condyle would articulate. Now the muscles to close the jaw are what you see in most mammals. You have a masseter muscle that originates along the zygomatic arch on either side, and that is going to insert primarily along the lateral aspect of the jaw, the dentary bone, in particular the coronoid process right there. And in addition to that, again, as in other mammals, you have in Aplodontia a temporalis muscle that originates along the sidewall of the brain case in this region, and it converges on the primarily on the medial aspect of the lower jaw here. And so when those muscles fire, the animal has a very powerful way to close its jaw. And the anatomy that I've just described, it's quite typical throughout mammalia, is called protrogomorphy. But that term protrogomorphy is generally applied just to rodents, and in particular Aplodontia and just a couple bathyergids, but it's quite rare. Protrogomorphy is quite rare among rodents. Now, the pattern of jaw-closing muscles that you see in a guinea pig are rather different. It, of course, shares a masseter muscle that has its origination along the zygomatic arch, and, of course, it has a temporalis muscle, which originates along the posterior part of the zygomatic arch and the sidewall of the brain case, but there's a major difference. And to illustrate that difference, I want to draw your attention to the infraorbital foramen in Aplodontia. It's not a particularly small foramen, but if you compare it to the infraorbital foramen in our guinea pig, the one in Aplodontia is much, much smaller, and the one in the guinea pig is gigantic. And that's what you're looking at on the right side, and here it is on the left side. And the reason it's so big is because one of these bodies of the masseter muscle, the zygomandibularis muscle that's originating from the sidewall of the rostrum traveling through the infraorbital foramen, has an insertion on the lower jaw that corresponds into this area here. It's sort of this large ridge that you can see along the lateral margin of the jaw all the way back to include part of that lateral face of the coronoid process. In this particular specimen, there are quite a few breaks in here, but that is where the zygomandibularis muscle is inserting in a guinea pig. Now, Aplodontia has a masseter muscle as well, of course, but that is fairly restricted to that ventral and external surface of the zygomatic arch, right? There's no major muscle that goes through that infraorbital foramen on Aplodontia. There's another aspect of these jaws, of these skulls, that I wanted to point out, and that relates in particular to the lower jaw. So if I orient them so you're looking at them, both jaws ventrally, both in the guinea pig and in Aplodontia, I want you to observe that the plane of that incisor alveolus in the lower jaw of Aplodontia doesn't really deviate that much from the ventral aspect of the body of this lower jaw. Aplodontia is, of course, very derived in many ways, not the least of which is this bizarre lateral extension to the jaw angle. And, of course, by now you will have noticed these really strange-looking upper teeth. So Aplodontia is a unique mammal in its own right, but in terms of its lower jaw, it exhibits what's known as sciurognathy, and that is defined whereby the alveolus, or the socket, the root of that incisor and the socket in the jaw into which it fits, does not deviate that much medially from the long axis of the jaw itself. Whereas consider that same anatomy here on our guinea pig. Now the incisors on the guinea pig in this particular specimen are missing, but you can still see the sockets quite clearly. Those are the alveoli plural, or alveolus singular, of the two incisors, one on either jaw. And if you just trace that alveolus posterior, you see that actually the corpus of that jaw, the main body of the lower jaw, extends quite a bit far laterally relative to that incisor alveolus. And this is a condition known as hystricognathia, and is contrasting to sciurognathy in the lower jaw.